Hi, my name is Dr. Kandy Bahadur, and I'm one of the pediatricians here at Watchung Pediatrics. I also serve as the nutrition coordinator for our nutrition program, and we thought it would be very helpful to record a webinar on introduction to complementary foods. So there are two different methods out there for starting complementary foods or solid foods, and that is the traditional purees, and then there's also the baby-led weaning method. No matter what type of method you use, it's going to be very important that you know the difference between choking versus gagging. So before you're preparing the food, you're going to want to make sure that you're preparing it appropriately for the developmental stage. And this is going to vary a little bit depending on baby-led weaning versus purees. And there are a lot of resources out there that can identify the best way to prepare based off of the age and developmental stage of your child. And no matter how old your child is, you're going to want to make sure that you're always supervising them while eating. Now I'm going to review the actual differences between gagging and choking. When your child is gagging, they may get red in the face, they may start coughing or sputtering, and if they have an exaggerated gag reflex, they may actually vomit. While this looks very scary, it is actually completely normal. Gagging is your child's body's way of figuring out how much food they can actually swallow, and it enables them to dislodge food if it gets stuck in the back of their throat. While it looks scary, it's also best not to intervene during this stage. Intervening, such as tapping on the back, may actually cause the food to dislodge further and may inadvertently cause choking. Choking, on the other hand, is an emergency, and you need to intervene with your child immediately. If your child is choking, they may be waving their hands in the air, they may have an open mouth, and be silent, and that's the key. They're unable to make any noises. And you may notice purple or blue discoloration to their face. If you notice any of these signs, you're going to have to intervene immediately and start CPR. So just to recap, loud and red, let them go ahead. Silent and blue, they need help from you. If you're not already CPR certified, we recommend that you register for a class on the American Red Cross website or the American Heart Association website. If you are certified, but it has been some time since you've last had the certification, we recommend watching refresher videos on YouTube. Keep in mind, any food can be considered a choking hazard if not prepared appropriately for your child's developmental stage. But there are foods that are particularly hazardous until your child develops a mature chewing and grinding motion of their jaw, which doesn't typically develop around 4 to 5 years old. These are cherry tomatoes, whole grapes, hot dogs, nuts of any kind, and popcorn. Prior to starting food, you're going to want to make sure that you have a comfortable and secure location for your child. Most high chairs come with the back reclined. In this position, your child is going to be leaning back like this, which right now I'm engaging my core muscles, and while doing this, I'm unable to chew and swallow properly. For this reason, I recommend taking a small towel, rolling it up, and placing it at the bottom of the high chair in the back. This will be at the lower part of your child's back. By supporting their lower back, you allow them to sit up straighter, and this gives them more trunk and hip stability, which allows for easier swallowing. In this example, you can see that the child is sitting against the back of his chair. If you look at his back, you notice that it's curved, and his body seems far away from the tray. In order to grab food, he'll have to constantly shift between sitting upward and then back down, which may tire him. In this second picture, you can see that his back is very easily supported with the towel. He appears secure and can easily grab his food from his tray. An added bonus is if you have a footrest. This may not be necessary, but as your little one grows, he or she will need to anchor their feet somewhere to provide added support. In this example, you can see that in the first picture, he has no footrest. In order to make his hips stable, he is taking it upon himself to hook his feet at the bottom of the tray. If you have no footrest, you can make a simple one with a box, or, as you can see from this second picture, even a pillow. This allows him to rest his feet and keep his knees and his hips flexed, which gives him added stability. The next question that I get asked very commonly is, when do I actually start my baby on food? When I counsel my families on when to start, I look at two main things: developmental milestones and gut maturity. There are certain developmental milestones that we want your child to achieve prior to introducing food. The first and most important is that your child is able to sit up briefly unsupported. By sitting up unsupported, their core muscles should be more developed and they should be able to hold their head steady. The next milestone is that they should have the start of the disappearance of the tongue thrust reflex. The mechanics of extracting milk from a nipple is very different from the mechanics of bringing food into their mouth, forming a bolus with their tongue, and swallowing the food. What we're looking for is that when you bring food into your child's mouth, they don't automatically push the food out of their mouth. The last two milestones that we want your child to achieve is that they should have interest in food. By this, they may be following your food with their eyes as you bring it from your plate into your mouth. And we want them to be able to bring their hands to their mouth and maybe even a spoon when it's ready for them to feed themselves. Most infants are able to exhibit all of these milestones at around 6 months of age. Additionally, their intestines are more mature in order to digest and absorb the nutrients that they need the most. Another common question that I get asked is, what do I actually start with? You may have heard the phrase, food before 1 is just for fun. I don't actually agree with this. I think that introduction of complementary food around 6 months of age is a very important stage to introduce different textures, flavors, and many different exposures. However, we want to optimize nutrition as much as possible from breast milk and formula. For this reason, we recommend giving breast milk or formula first, and then 30 to 60 minutes later, if your child is showing interest in food, that's when you can start giving the food. If you were to take a jar of store-bought baby food and look at the calories per ounce, you'll notice that it is a lot less than it is from a 4-ounce bottle of breast milk or formula. With less calories per ounce, your child may require more volume in order to feel full. However, they're not getting as many calories in, and so for this reason, we recommend doing breast milk and formula first and then giving your baby the food. So the actual order of giving food doesn't really matter. You can give food in whatever order you want. You can do veggie first, or you can do meats first. They do have preferences and they do develop this early, but the key here is to rotate the food so that your child is getting exposed to many different types of foods. Your infant's iron stores in the body do start to deplete around 4 to 6 months of age. For this reason, we recommend that you focus on iron-rich foods. So we used to recommend giving one new food every 3 to 5 days. That way, if your child has a reaction, you're able to better pinpoint what they're reacting to. This information is now controversial. However, we don't have any new official guidance from the Society of Allergy and Immunology, so I still recommend giving one new food every 3 to 5 days, and once they've tried a variety of different foods, you can start to combine and mix their food up. Don't be afraid to play around with different spices for your child. This is going to add many different flavors, and this will be important as they expand their palate. The only recommendation is to limit the amount of salt that you're giving, as their kidneys are still maturing and we don't want to overload with extra salt. You're going to want to feed your baby such that you're following their cues. So if your baby is showing that they are full, they may be turning their head back and forth, they may be pursing their lips, or they may be batting the spoon out of your hand. This most likely means that they are full and they don't want any more food. You don't have to start your child on cereals. But if you do, we recommend trying oatmeal instead of rice, as the rice cereals have been shown to have a lot of arsenic. The goal is to have your child eating the same type of food that you're eating within reason by around 9 months of age. Some children do get there a lot sooner than others, and some take a little bit longer. That's okay. You're going to want to increase the texture of the foods as tolerated by your child. You don't need to wait for teeth in order to do soft, mashable finger foods. Their gums are very strong and they will be able to mash the foods as needed. If you do the increased texture and you notice that your child is having a particularly hard time with swallowing, you can always go back to the softer purees and then try again in a couple of days. Just a reminder, when your child gets to the soft finger food stage, you're going to want to make sure that you're preparing appropriately so that it does not pose as a choking hazard. When can I introduce utensils? You can actually start as early as 6 months old. Most children will get the hang of it around closer to 9 to 12. There are several different methods that you can do. You can actually preload the spoon or the fork with food and place it on the tray and have your child bring the utensil to their mouth. You can preload it and then put it in your child's hand, or you can just give the spoon or the fork and have your child try to do it with modeling from when you're eating. Let's talk baby-led weaning versus traditional purees. First off, I want to mention that there is no right or wrong way to feed your baby. Whether you feed with traditional puree or with the baby-led weaning approach, we recommend to follow what we call responsive feeding, which is just a fancy term to say, follow your baby's cues. Never force or pressure your child to feed, or even force your child to eat a certain number of ounces a day. As mentioned in a previous segment, if your child is turning away from food or pushing the food or spoon away, that means that they're done, and we want to respect that. So let's start with traditional purees. Traditional purees can be either store-bought or made from home. It starts out as thin liquids, and as your child develops, they are given increasingly thicker textures. So they are progressing from liquid to mashed and chopped to finger foods, which is our goal. This method is a more drawn-out process, and infants typically reach the stage of eating finger foods by around 8 to 10 months of age. There are claims that this method, 1, may not be necessary, 2, may be expensive if you're buying food, 3, could make your infants dependent on their parents to feed them, 4, pose a higher risk for overfeeding or forced spoon feeding, and 5, potentially lead to picky eating. I do think most of these claims are false, with the exception of expense when buying baby food. As mentioned in an earlier segment, you can introduce utensils and foster independence with feeding, even with purees at an early age. If you are allowing them to feed themselves with utensils and you are preloading in the beginning, they won't necessarily have that risk for overfeeding, especially if you practice responsive feeding. The term baby-led weaning is actually a misnomer. There's no weaning of breast milk or formula. It's simply an approach where you skip purees and spoon feeding and move on to baby controlling their first bite with finger foods. By 6 months of age, it's thought that your child has the motor skills necessary to support their trunk and head, bring food to their mouths, and chew their food, even without teeth. This method fosters independence, as babies are encouraged to pick up all their food with their own fingers and feed however much their bodies need. If you choose this method, I strongly recommend for you to wait until at least 6 months of age, or even a little later, as your child will need to have really good head and trunk control, as well as the loss of the tongue thrust reflex to minimize their risk of choking. There are many resources available that depict how to prepare food and cook the food so that it does not pose as a choking risk. One example is the Baby-Led Weaning Cookbook by Dr. Rapley. This is really popular, as the visual images are extremely helpful. If you do choose to go this route, it'll be really important to research this method thoroughly and find the resources you like prior to initiating. As you can imagine, this method may be a little wasteful in the beginning when your child hasn't quite gotten the hang of eating and maybe gnawing in several different pieces of food, but not quite chewing or swallowing much of it. Another potential disadvantage is that since your child may take some time to get the hang of eating sufficient amounts, they may not be taking in enough iron to help restore the iron stores in their body, which may make them at increased risk for iron deficiency anemia. There were a lot of mays, so as to date, there are no studies reviewing the risk of iron deficiency with baby-led weaning versus traditional purees, so this is a theoretical risk. Contrary to what staunch proponents of baby-led weaning say, you can do a combination of these two methods, and it will not confuse your child in terms of swallowing versus chewing. If you feel more comfortable, however, you can even do purees for the first few weeks or even 1 month, and as your child improves with their oral and gross motor skills, you can switch over to finger foods sooner than the traditional 8 to 10 months. This is personally what I did with my second son, and it's been wonderful. Some aspects seen in both methods include both can actually be really messy in its own way, so don't let this swing your decision one way or another. Both can help encourage family meals. The baby-led weaning method teaches you to give the same foods that you're eating, so you're not preparing different meals. But with traditional purees, you can either puree the food that you're eating and give that to your baby, or give them the purees on the preloaded spoons while you're eating, so that you can model the behavior that you want your baby to pick up on. As far as picky eating goes, I've actually seen picky eaters from both the traditional purees and the baby-led weaning approach, so I don't think that this is only a risk with purees. The key with picky eating is to expose, and offer in a very low-key, no-pressure environment. Both methods can foster independence and can teach you to respect your child's satiety cues. And most important, both methods can actually lead to happy, healthy eaters. No matter what method you decide to proceed with, there are plenty of resources available. This is a small list that I put together, but it is in no way exhaustive. I encourage you to use whatever resources you find. When starting solids, you may notice that your child's stool habits may change considerably. This is common and this is very normal. You may notice that the texture becomes a little harder and it may become more malodorous. If you find that your child is having a particularly hard time pooping, you're going to want to introduce the P fruits. P for pooping. These include peaches, pears, plums, papaya, pineapple, and prunes. One thing you can do if your child is having a hard time pooping after introduction of solids is by introducing water. Water is not mandatory at this age, but at 6 months, your child's kidneys are able to handle it. If you do start water, it is best to start in small amounts. 1 to 2 ounces is all that they need, and we recommend to do it in a cup, which we'll talk about in a little bit. All of the hydration that your child needs is still going to be primarily from breast milk and formula, so the water is just to introduce them to the taste. The AAP does not recommend any sugar sweetened beverages under the age of 2. This means no juice, even if it says 100% juice. This may change depending on if your child's doctor has diagnosed them with constipation. There are several different cups available on the market, and it can be stressful to decide which one to start with. The good news is there's no wrong way, and each cup has its own pros and cons. If you have a sippy cup, you can use that if that's what's available. It's not ideal as it doesn't promote proper oral motor development for teeth and speech, but if that's what you have, you certainly can use it and then transition to another cup as your child gets older. You can also start with an open cup at 6 months. Here are 2 examples. This is an easy peasy cup, and this is a regular shot glass. If you are using a smaller glass open cup, you may want to put rubber bands around it so that way the grip is easier for your child to pick up and put down. One method of teaching an open cup is to use the hand over hand method. In this method, you're going to have your child's hand on the cup and you're going to bring your hand over your child's hand and show them the mechanics of lifting the cup up to their mouth. Teaching an open cup takes a lot of practice from both you and your child. It will be very messy, but the rewards will definitely be there once they're able to gather. You can also start with or transition to a straw cup at around 6 to 10 months of age. Here are 2 examples. This is a weighted straw cup by Munchkin, and this is the traditional take and toss cup. You're going to need to teach your child how to use a straw prior to introducing these cups. One method of doing so is that by taking the straw, immersing it in water, and suctioning the top of the straw with your finger, lifting it up, and waiting until your child puts their lips over the other side, and once they have a pursed lip, you're going to release the liquid into their mouths. Doing this over and over again will teach them that by sucking, it will reward them with liquids, and they will pretty soon get the hang of it. The weighted straw cups are really helpful for avoiding spills, and it allows the child in whatever position they are in that the water will be able to come through the straw. This is not physiologic, so some occupational therapists don't recommend this. However, it is very helpful. The other thing to note is that with the valve, because of the spill proof, they have to suck very hardly on the straw in order to get liquid. This is an example of a Munchkin 360. The Munchkin 360 is a good transition cup to an open cup. However, the mechanics of getting the liquid out is not physiologic, and most occupational therapists don't recommend it. One benefit of the Munchkin 360 is that it is relatively spill-proof, so if your child throws it with not a lot of force, the liquid will stay in the cup. Be careful with those children that have a very strong throw. If you do throw this with enough force, the liquid will seep out from amongst the sides, so just be careful about that. Regardless of which cup you decide to start with, it will be important for you to transition your child off the bottle between 12 to 18 months. The earlier you get them off the bottle, the better it is for them. Pediatricians used to recommend delaying allergenic foods until after your child's first birthday. However, in 2015, an important study was released called the LEAF study, Learning Early About Peanut Allergy. In this study, 640 infants that were considered high risk for peanut allergy were assigned to one of 2 cohorts. The first cohort was early introduction of peanut between 4 to 6 months, and the second cohort was avoidance of peanut. At age 5, they gave all infants an oral peanut challenge. What they found is that those in the avoidance group had a peanut allergy of 17.2%, whereas those in the early introduction of peanut developed an allergy only at 3.2%. The authors further categorized the recommendation to start peanut based off of certain risk factors. If you had no eczema or no food allergy, you were able to introduce early and in accordance with family preferences. If you had mild to moderate eczema, they recommended to introduce at around 6 months of age. If you had severe eczema, an egg allergy, or both, they recommended discussing this more with your doctor. At this point, your doctor can refer to an allergist for skin testing, or if they have the capabilities in their office, to do serum or blood testing for specific allergens to egg or peanut. The results of this will guide if and when to introduce. So if it was determined to start your child early on peanut introduction, there are several different ways that you can do this. The first and easiest way is to actually melt some peanut butter in warm water and mix it into the purees that you're giving your child. The first time that you do this, you're going to want to make sure that your child is going to be observed for at least 2 hours. And if you notice any type of reaction, facial swelling, vomiting that's persistent, whole body hives or difficulty breathing, you're going to want to call 911 immediately for EpiPen injection. If there's no reaction, you're going to want to continue giving peanut in your child's diet up to 3 times a week. Other ways to introduce are through peanut powder, which you can mix easily into your child's food, or Bamba, which is a peanut butter puffs that melt in your child's mouth. They do sell these on Amazon and Trader Joe's as well. We hope you found this webinar on all the different components of introducing complementary food helpful. If you have any questions or concerns, please don't hesitate to reach out to your primary care provider here at Watchung Pediatrics. Thank you and have a great day.